Good evening, everyone. I'm Krista Gutierrez. UNM Hospital has put a patient in isolation, and the state health department is calling in the CDC to conduct tests to make sure that patient does not have the Ebola virus. News 13's Catherine Mazzone is live in Santa Fe, where a doctor familiar with the case just spoke to reporters. Catherine?
Oh, that's right, Crystal. Now, doctors are saying that at this point, it should be very soon before they find out the results of those tests. Now, health officials are not saying that this woman has Ebola. They're saying she doesn't just yet. They're not saying she doesn't just yet, rather. Now, officials say the 30-year-old woman is a patient at UNM Hospital and developed a sore throat, headache, muscle aches, and a fever, all of which are symptoms of Ebola. Add in the fact the woman recently left an area in West Africa with known cases of Ebola, and that sparked concern. Officials say she was a teacher there, but before she left earlier this month, she had no known exposures to Ebola. She also says that she took a lot of precautions to make sure she was following the correct protocol.
In terms of not exposing others, presenting to the healthcare provider community immediately and getting evaluated quickly. And the healthcare provider community did exactly what we've been asking them, which is to contact the Department of Health, and we're available 24/7.
Now, state officials say at this time she is not a probable case. They're really emphasizing that. But out of caution, they are working with the Centers for Disease Control to conduct tests to ensure that she does not, in fact, have Ebola. Crystal, back to you.
All right, thanks, Catherine. Now, state health officials are working very closely with UNM hospital officials on this case. That's where the patient is currently in isolation. News 13's Gabrielle Burkhart is live at UNM Hospital, where she just spoke with hospital staff to find out what they're doing to make sure other patients are safe. Gabrielle?
Crystal, now doctors stressed to us this is not a confirmed case of Ebola and that they're following protocol to keep everyone safe, as you mentioned. Hospital officials say the female patient is in a room by herself. They're minimizing who goes in and out of that room, and when they do, staff wears protection, including gloves and eye protection. Now, here's what we know about Ebola. According to the CDC, Ebola, quote, poses no substantial risk to the U.S. general population. Doctors also tell us that a person infected with the Ebola virus is not contagious until symptoms appear. The virus is spread through direct contact, like broken skin or mucous membranes. Ebola is not spread through the air or by food or water. UNM hospital staff say there is no reason as of now for the public to be concerned.
We're taking every precaution necessary to make sure that there is no transmission in the hospital setting. And again, the patient's in a private room. The staff has been educated and trained.
Now, the patient will likely have blood tests sent to the CDC to determine if this is a case of Ebola. That could take a few days. Back to you.
All right, thanks, Gabrielle. Now, as of August 13th, no confirmed Ebola cases have been reported in the U.S. other than the 2 U.S. health workers evacuated from Liberia. The American doctor receiving experimental treatment at an Atlanta hospital for Ebola is recovering now. On Friday, Dr. Kent Brantley released a statement saying there are still a few hurdles to clear before he can be discharged and reunited with his family. Brantley and American missionary Nancy Wrightbull were transferred earlier this month to an isolation unit after contracting Ebola while helping patients in Liberia. The World Health Organization says at least 2,100 people have been infected in West Africa and more than half have died.